All right, good morning, everybody. My name is Amanda, and I am here with Kimberly King and Josh Beard. We are really excited to invite Kimberly to hop on our webinar here at Go4. She is going to join us for a three-part webinar series talking about all things that they have going on over at the Depression Bipolar Support Alliance. We have been working together now for a couple months on this, Kimberly, and I'm so pumped to see it come to fruition. I think what you guys have going on over there is awesome. So without further ado, I am just going to kind of run through everyone introducing themselves, giving a little bit of their background so people know who we are and what we're bringing to the table. I'm going to go last, actually, so I'm going to kick it over to Josh first here so that he can say a little bit about himself, what he does at Go4, and then we'll kick it over to you, Kimberly, and I will bring some.
Yeah, great. Thanks so much, Amanda, and Kimberly, thanks again for joining us. My name's Josh Beard. I'm the athletic trainer community manager at Go4. I have been a certified athletic trainer since, 2005. I spent the majority of my career in the Division I university setting, but I also spent some time in the secondary school setting as well. So I've been a lot of different places as an athletic trainer, so I can really relate. And my job at Go4 is to interface with all of the athletic trainers that use the app to work per diem, make sure they're having a good experience. If they have any questions or need support, whether it's with the app or even just another athletic trainer to talk to, that's why I'm here, and I love being able to speak with athletic trainers all across the country.
Cool, thanks, Josh. Kimberly, take it away.
Thank you, Amanda. Thank you, Josh. It's such a pleasure to be here. As was stated, my name is Kimberly King, and I am the Senior Manager of Mental Health Equity and External Partnerships for the National Office of the Depression and Bipolar Support Alliance, better known as DBSA, which is located in downtown Chicago. DBSA is one of the leading peer-based patient advocacy or peer organizations who is specifically focused on depression and bipolar disorder and advocating for the lives of those who are impacted by those conditions. I was born and raised in Chicago, as Michelle Obama is famous for saying, and I feel that in my heart every time she says it. My background has been in community health and nonprofits since 2005. I've traveled and done many things along this nonprofit professional journey, and where I'm at now is I've been with DBSA now for 4 years. My primary responsibility within DBSA is to manage our relationships with our medical product development or healthcare partners. These are primarily pharmaceutical partners, and also help provide support to the national organization in its efforts to diversify our audience and make sure that mental health equity is a lens in which everything that we do is looked for.
Amazing. That's awesome. And, just hearing you talk about what you guys are doing over there really gives a little bit of insight on why I think this is such an important series that we're doing with you guys. My name is Amanda Kammes. I wear many hats at Go4, actually, but most specifically, I deal with the RN side of the business. Similar to Josh, I deal with all the RNs that come onto our platform, support them through their journey of creating their account and updating their profile, all the way through any job issues, questions, concerns that they might have while they're actually on site working that position. My background, I actually am a registered nurse. I have my master's in nursing as well. And I've been all over the place in terms of my background in nursing. So I've worked with in the ICU setting with total brain injuries and spinal cord trauma, all the way to cardiac and medical ICU setting, and bringing it home to some per diem as well, which is what Go4 specializes in. So I have had my hands in a lot of pots, but I really believe that the mental health piece to things that are going on right now in America and beyond is really, really important, both from individual setting, and also a healthcare professional perspective as well. So while we get started here, I'm going to hop right in, Kim, put you on the hot spot here. We all know that it's kind of been a hot topic in 2022. You see a lot of people, even on social media platforms now, kind of making their accounts about mental health awareness. Depression has been a very big topic as of late, which is, honestly very good to see, because what used to, I think, be a very taboo topic is starting to become a hotly discussed topic and really come to the forefront to be out in the open and not stigmatized quite as much as I think maybe it used to. So I'm going to ask you, can you share with us some info about resources that DBSA provides, and how might some of those resources not only help our healthcare providers support their athletes or their patients on the RN side, but also potentially their own needs?
Sure, absolutely. So I want to take a step back just to share a little bit about the history of DBSA and who we are and what we do, because I think the history adds context, and it's very important in understanding where DBSA as an organization has grown from the last 37 years to where we are now. So DBSA is, as I mentioned earlier, is one of the leading peer-based national organizations focused on specifically depression and bipolar disorder. These are two of the most common neurological conditions that impact over 20 million individuals per year. And DBSA reaches nearly 4 million individuals who live with mood disorders and or are caregivers, family, and loved ones of those who live with mood disorders, as well as other stakeholders in the space, through our online peer support resources and services, and as well as through the efforts of our local grassroots chapters and their work locally.
That's awesome. Now, are those grassroots chapters, where are those located? Do you have a national reach? Are you in just major city pockets?
Sure, that's a good question, and it's often sometimes a challenging question. Most people learn about DBSA as a whole through our website, dbsaalliance.org. However, our national office, while we have a limited direct service that we provide on a national level. On a local level, our chapters and support groups, who are individuals who live with a mood disorder or impacted by mood disorder in some way, they operate local support group service chapters, which provide support groups throughout the country. And DBSA National provides support to those individuals so they can have the resources to do the work they do in a local area. So DBSA helps assist with, we have over 100 chapters throughout the country that operate over 600 support groups throughout the year on a weekly basis.
Whoa.
Yes.
And those are all free. Those are free to attend.
Absolutely. Free services. These are done by people who come to DBSA because they are interested, they have a lived experience and they want to support others. And they usually start by wanting to start a support group. However, many of those individuals also decide that they want to have more autonomy over what they do in their local community. So they form a chapter, which is a independent affiliate, which provides support group services and other activities such as advocacy, education, outreach to the community they're in. The national office supports those efforts and also works on advocacy on a local and federal, national level, and provides free education resources, tools, training to all those in our community and network.
And now you mentioned that some of the resources are also online on your website. What kind of resources would I be able to find on your website if I were an individual that were interested in that?
Sure. So for nurses, for athletic trainers, we are any clinician or person that has contact with individuals' health as a whole. We have resources to help you find a support group in your community. We have resources that help you to find where peer support organizations that are under the DBSA umbrella are located, so you can get more involved in not only support groups, but advocacy as well as outreach efforts and education efforts. Through our website, you can also access all different educational materials that we have, and resources, including our wellness wheel, which is a self-guided journal source that's available digitally, but it's meant to be printed out or saved to your computer, which helps you look at 7 areas for wellness. These are not things that DBSA created. These are actually created based on SAMHSA and other guidances in terms of what is wellness and what impacts wellness, and allows individuals to take the journey themselves and explore those different dimensions. We also have resources for children, teens, and young adults. That is either through the Mood Crew, which is a animated based resource that provides children and parents and caregivers opportunities to talk about emotions that impact mental wellness as early as age 4. We have wellness journals in terms of tracking your day-to-day that can help you talking to and empower you to talk more confidently to your family, to your provider about your tools. We have training resources, both for a volunteer level of people who are interested in mental health advocacy, either as someone with lived experience or otherwise, as well as information about peer workforce development programs, such as our peer support training course, which DBSA does in conjunction with the VA, and has a best-in-class program, which helps individuals who are seeking to become certified peer support specialists find a way to navigate and become have that as a means of employment.
That's incredible. That's a lot of resources. And, I think it would be really powerful if Josh and I, kind of peruse some of those resources and maybe reshared some of those resources out to our community members. Just based on some of the things that you kind of just were chatting about, I can think of a lot of things that I know from a nurse perspective. The journal, I think, would be a great tool to kind of share out there for people to use. The wellness wheel, I think, is a really interesting one that I think would be valuable to share out and use. And Josh, I don't know if you can think any that just kind of hit you right there, but some of even the adolescent and kid friendly ones I would think would be of some value for our athletic training crew who interface with the younger age groups more regularly than some of our RN population.
Yeah, absolutely. Some of the athletic trainers in the middle school and secondary school, having resources for them, to be able to help them through anything that they might be experiencing, I think it would be great to share over. And
also want to add that DBSA, in our efforts to support our mission, which is to provide hope, and support and education to improve the lives of those who live with mood disorders, we are committed to promoting diversity, equity, and inclusion to enhance all mental wellness for all. We recognize the way that social cultural identity and access affect people living with mood disorders, and we strive to create a safe and inclusive space for individuals so they can feel empowered to find their own path to wellness. In that way, we try to create equitable access to peer support services and mental health resources for all individuals who live with mood disorders, regardless of cultural or social identity or systemic barriers, which we think has increasingly, as you mentioned before, Amanda, in the midst of everything that's going on, has gotten more light, and many of us already know is long overdue. And we also know that social cultural identity also impacts access to care. And the more that we are able to look at it through that lens, the more comprehensive and complete, we can be in terms of the services that we provide. And we, really like to encourage others, our partners such as Go4 and others, to go along that journey with us, because we are still growing and learning. But I'm so proud to see the work that we've done just in a short time. I've been with the organization, although this work started many years ago. It's just now we're calling the thing, as I call it, and being intentional within that.
Yeah, and I just think, you guys, thank you for sharing all of that information, Kimberly. It's really powerful to see what you guys are doing over there. I've been impressed since I met you at the conference. Man, it seems like many moons ago at this point, but it wasn't that long ago. It was just this summer. But You know, I think that from a healthcare provider perspective, as I mentioned at the top of this webinar, it's often such a you know, brushed under the rug, not really discussed kind of topic, when in reality, especially coming off of COVID and all of the stuff happening in society today, it's magnified now. And I'm not only a nurse, but I work with kids too. And you see a lot of the stuff happening that today really impacting kids in the adolescent group is just so intensely affected by depression, anxiety, and things of that nature, just on a day-to-day basis. So having resources that we can share and kind of push out and, you know, hop on that journey with you guys to make things accessible to groups that we work with daily at Go4, and also for our own healthcare providers also have in their toolkit, you know, just to, it extends the reach of how many people we can impact and truly help, and start working to make it less taboo and make the thing a thing, like you said. I like that. And I'm going to start using that, if that's okay with you.
Absolutely.
Okay, cool. So I think that's great for our first one. What I think a great follow-up would be is for all the people that are on watching this, Josh and I will share out some of DBSA's really valuable resources here over the next couple of weeks as we move through the holiday season, which I just think is also a particularly poignant time for depression. And you have seasonal depression coming up here too. With the weather changing and the days shortening. So we will do that for our crew. And hey, join us again. We're coming back, I think, Kimberly. We're looking at January for our next one, or February, somewhere around there for our second webinar. And then we'll do one in the spring as well. So next time we're going to have a totally different topic. I think we might even have a guest speaker speaking to, you know, topics that we've brought up today and resources that Kimberly has mentioned. So I really appreciate your time, Kimberly. Every time we talk, I just am so blown away by what you guys are doing over there. And it's just so important. And I just value our relationship and working with you guys. So thank you.
Thank you. If all possible, I really would like to share with your members more about what peer support is, because I think that's a really important aspect in talking about the resources and the tools, because you can have all the resources and tools you want, but if you don't understand the connection, it's not saying that you wouldn't, because it's not, I always say it's not rocket science, but I'm very focused on people understanding what peer support is and why this is a value, and talking a little bit about that stigma and why individuals may not know what peer support is or how it impacts mental health, and how that informs the work that we do at DBSA. So
please do.
Yeah.
I should have asked you about that. That's my bad.
No worries. So I'm gonna use some language that our peer policy and investment team uses in explaining what peer support is and how this adds value to supporting individuals who live with mood disorders. So SAMHSA, which as many of you already know, is the Substance Abuse and Mental Health Service Administration, which is federally regulated, defines peer support services as a range of activities and interaction between people who share similar experiences of being diagnosed with a mental health condition and or substance use disorder, or both. By using their shared and lived experience and practical guidance, peer support workers help people develop their own goals and create strategies for self-empowerment and to take concrete steps towards building, fulfilling, and having self-determined lives for themselves. So when I say peer support, it's not merely a jargon or marketing word, but it is a practice that supports one's mental wellness. And DBSA was founded and created by individuals who live with mood disorders, specifically Rose Curlin, who is one of our founders. She just celebrated her 77th birthday, and I actually got the opportunity to meet with her. Miss Curlin was referred to another patient by her doctor, Dr. Jan Fawcett, who is now I believe he's now deceased. And he basically asked them, like, you know what, you both have similar lived experience in mental health conditions. Why don't you talk to each other? And from that basis, and with his support, DBSA was formed, but we weren't always called DBSA. We actually used to be referred to for what used to be defined as, depression, or defined as depression or bipolar, or the National Manic Depressive Association, because language changes and the time change. That's where we started. And Dr. Jan Fawcett was an advocate for a patient, Rose Curlin, to start this support group, because he recognized that peers are able to provide a support and a connection with each other that others, clinicians and others, do not have or are able to have because of all the political and clinical logistics. And it's something that is recognized through science. It's not just something, a cute thing to say. I said it all the time. Like I said, I'm born and raised in Chicago. When I first came across DBSA, I had never heard of peer support. I'm going to be quite candid, even though I have a background in psychology, educational background in psychology. So I think there's really an importance to peel back the layers to understand how DBSA came to be, what peer support is, how providers like Dr. Boston and others have helped lead the way to DBSA and peer support being recognized within the clinical community and healthcare community, and to continue those efforts on and making sure that we're providing education on not only what it is, why it is, but how that informs and helps and shape what we're doing in our work, whether we are a nurse, an athletic trainer, a nonprofit fundraiser like myself. There's so many connections, and so I just feel like it's invaluable to understand the root of it, because that is the heart of who DBSA is, and I think that informs everything we do and how we move forward.
How would someone like me or Josh get connected to peer support?
Well,
is that just through our community, or would you guys be able to direct us to maybe one of your like local chapters to find that support?
Sure, we can do both. Peer support exists in so many forms. DBSA didn't invent peer support as a whole. We are just one agency organization that is trying to do work in this space. A lot of this work is being done in churches, it's being done in other civic organizations, but it's not defined as peer support. Yep. So organizations like DBSA and many others are here to provide a basis for connection. We recently just updated our tagline to find community, find hope, find wellness. And those are the tenets of which we live by and the services of which we attempt to provide. So one of the ways to start out is to find DBSA, as I said before, is our website. That's dbsaalliance.org. That's how most people hear about us. They usually are referred from a friend or their doctor, or actually from a support group member that they may have had contact for in the community. So that's the first basis. And then there's many different ways to be involved. People often come to us not only for themselves, but because they are a care provider of some sort, or a loved one of someone living with a mood disorder. And that's why that's another very important audience for DBSA, because in order to provide more resources, in order to get more understanding, to reduce stigma, we have to talk about it not only from the lived experience of the person with the condition, but also for everything and everyone that impacts, which I always say we all live on a spectrum of mental wellness. There's not one person that's not impacted by mental health in some way, shape, or form, whether it's episodically or for a chronic diagnosed condition. It is, all of us have, I think, a responsibility and to at least understand, and organizations like DBSA have a responsibility to make sure we're informing our community members of what we're doing, why we're doing it, and making sure we're getting input from all sectors, from the patient or peer, from caregivers, from providers, health providers, trainers, etc.
Amazing. That is, thank you for making sure you clarified what that is, because that is, sometimes I think the peer-to-peer stuff is almost the most powerful tool you have. And especially in our healthcare communities, that might be one of the most beneficial ways to, encourage somebody to start on their journey of mental health in some capacity. So thank you for explaining that.
And by no
Josh?
means, I'm sorry, I didn't mean to
Oh,
cut you
go
off.
ahead, yeah.
But by no means do we say, or is the expectation that peer support replaces medical care. And it serves as an auxiliary of support, and understanding that some people will never go to the doctor's office or psychiatrist's office or a social worker's office to talk about mental health, but they will talk to people who have a shared experience, and understanding how that can help, how peer support and having that community can help support outcomes that providers are looking for in terms of things like adherence, which is a nasty little word, and mandate, but necessary, because that's just human nature. We have to have words and they mean different things in different contexts. But peer support is actually a tool for providers to utilize to help their patients and the people that they serve get the care they need, and follow care plans, and more importantly, develop partnerships to allow individuals with a mood disorder to have empowerment over their own lives and be able to help collaborate in their care versus a hierarchical authoritative type of viewpoint.
Certainly, totally different way to approach their mental health journey. I'm even thinking of just, some people in my own, personal experiences that would prefer the peer-to-peer experience 100% over the authoritative, formal doctor experience. So, I can certainly see why that is important in this space for sure. Josh, do you have anything to add in here or poke Kimberly about before I let her off the hook here for the day?
I don't. I really appreciate it. This was so enlightening for me, just to hear about all the different resources that you offer, and just thinking about how that could be useful to a number of different, whether it's healthcare providers or just, individuals really anywhere, just because, like you said, I think the shared experiences is still valuable to connect people, and to kind of help them open up about some of these things. So yeah, I think that's great. I can't wait to learn more about the resources that you offer.
Well, thank you
for the opportunity.
Yeah, Kimberly, it's been awesome and a pleasure as always. Like I mentioned before, happy holidays to you too and everyone else here listening. And we will push out information about the second webinar here just after the new year at some point. So make sure you come back to get some more information as Kimberly drops all of her knowledge on us. I appreciate you both. Have a great day.
Thank you. Happy holidays, everyone.
Thanks so much.
Bye-bye.
Bye-bye.